Part A. Extract 1. Questions 1 to 12. You hear a lactation consultant to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Thanks for coming in today. I'm Kenzie Fair, the lactation consultant.
Hi, Kenzie. It's nice to meet you.
So, Mihiraa, what brings you to the clinic today?
I'm concerned about my milk supply. My baby seems hungry all the time and isn't gaining weight as quickly as the pediatrician would like.
I understand. Before we go further, can you tell me a little about your own medical history? Have you had any previous surgeries or conditions that might affect breastfeeding?
Negative, there are no significant medical interventions or conditions affecting my overall health.
Okay, and how was your delivery? Did you have a vaginal birth or a cesarean section?
It was a vaginal delivery, but it did go a little long. The baby ended up needing some assistance coming out with forceps.
Interesting. Now, can you walk me through a typical breastfeeding session? How often do you feed your baby and for how long?
I try to feed him every 2 hours, but sometimes he seems unsatisfied and wants to nurse more often. I usually let him feed for as long as he wants.
And how many wet and dirty diapers does your baby have a day?
Maybe 6 or 7 wet diapers, but only a couple of poopy ones.
Have you noticed any pain during breastfeeding? Are your nipples cracked or sore?
Yes, indeed. They occasionally feel tender, particularly at the start of a feeding session.
Okay, Mihiraa, thanks for being so open. There are a few things we can discuss that might be affecting your milk supply, including your delivery and latch issues due to sore nipples. I'd like to observe a feeding session if that's all right with you.
Yes, that's fine.
Thank you, Mihiraa. Well, it looks like your baby might not be latching deeply enough to effectively transfer milk.
Oh no. What should I do?
Don't worry, this is quite common. We can work on some techniques to improve your baby's latch and help increase your milk supply. I can also recommend a gentle nipple cream, lanolin, to soothe the soreness.
Is it safe to my baby?
Absolutely, Mihiraa. This nipple cream is safe for your baby. It's made from natural ingredients and is specifically designed to soothe and protect sore nipples without harming your baby. Just make sure to apply a small amount and ensure it's fully absorbed before breastfeeding. If you have any concerns or if your baby shows any signs of sensitivity, we can explore other options. Your baby's health and safety are always our top priority.
Okay, that's fine.
We can arrange a subsequent consultation in 7 days to assess the efficacy of the implemented interventions and monitor the ongoing progression of your lactation and breastfeeding journey.
Sure, why not?
In the meantime, there are some resources I can give you about proper latch technique and increasing milk yield. Do you have any questions for me today?
Extract 2. Questions 13 to 24. You hear a sports medicine physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. So, what brings you in today?
Hi, Dr. Clarkson. Thanks for seeing me. I actually sprained my ankle pretty badly playing basketball yesterday.
Ah, I see. These are quite common with sports injuries. Can you tell me a little more about your medical history? Have you had any previous injuries or surgeries?
Not really, doctor. I'm generally healthy. I did have a minor fracture in my right wrist a few years ago, but it healed completely.
Okay, good to know. Now, can you describe the fall in more detail? Did you hear any sounds?
Actually, yes. There was a sharp pain and a popping sound when I landed on my ankle. I couldn't put any weight on it at all.
That's concerning. How would you rate the pain on a scale of 1 to 10, with 10 being the worst?
Right now, it's about a 7. It's throbbing and feels quite swollen.
Alright. Let's take a look. There is definitely some swelling and tenderness around the outer ankle bone.
Yes, doctor. There is.
Mihiraa, let me move your foot in dorsiflexion. It is a movement where I gently bend your foot upwards towards your shin, which helps assess the flexibility and range of motion in your ankle. So, may I have your permission to perform this movement to evaluate your ankle function?
Okay, you may please.
Is there any pain when I move your foot in this direction?
Ouch, yes. That definitely hurts.
Okay, that suggests there might be ligament involvement. I'd like to get an X-ray to rule out any fractures.
Sure, that sounds good.
The X-ray is clear, which is good news. Based on the exam and your symptoms, it seems you likely have a moderate ankle sprain.
Okay, so what does that mean for me?
The good news is with proper treatment, most sprains heal completely within a few weeks. The key is rest, ice, compression, and elevation. I'll prescribe you an ankle brace for support and some pain medication to help manage the discomfort.
Great. When can I get back to playing basketball?
Well, let's prioritize healing first. I recommend avoiding strenuous activity for the next 2 weeks. We can then discuss a rehabilitation plan to gradually strengthen the ankle and improve your range of motion.
Sounds like a plan. Is there anything else I need to do?
Definitely. It's important to keep an eye on the swelling and any potential signs of infection. If you experience increased redness, warmth, or fever, come back immediately. I'll also give you a referral for physical therapy to work on regaining strength and stability after the initial healing period.
Thank you so much, Dr. Clarkson. That's very helpful.
You're welcome, Mihiraa. Should you have any inquiries, please feel free to contact us. We anticipate seeing you in a fortnight for your subsequent follow-up appointment.
That is the end of Part A. Now check the answers. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Hey, Alex, have you got a minute? I need to brief you about a new patient, Mr. James Carter. He's been admitted with a complex set of symptoms, and I want to make sure we're on the same page.
Sure, Mihiraa, go ahead. What's the situation?
Well, he's a 58-year-old with a history of hypertension and type 2 diabetes. He came in complaining of severe fatigue, shortness of breath, and occasional chest pain. At first glance, it seems like a cardiac issue, But here's the tricky part. His blood work shows elevated liver enzymes, and he's also been experiencing abdominal discomfort.
That's unusual. Could it be a liver problem complicating his cardiac symptoms?
Possibly, but there's more. He's been on a new medication for his diabetes, which has a known side effect of liver toxicity. However, he's also been self-medicating with over-the-counter painkillers for joint pain, which could also explain the liver issues.
So, we're looking at a potential drug-induced liver injury, but we can't rule out cardiac involvement either. What's the plan?
Exactly. We're running an echocardiogram to assess his heart function, but we've also scheduled an abdominal ultrasound. For now, we've stopped his new diabetes medication and advised him to avoid painkillers. We'll monitor his liver enzymes closely.
Sounds like a solid approach, Mihiraa. Let's keep an eye on his vitals and symptoms.
Agreed. I'll update you after the test results come in.
Now look at question 26. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Hey, Sarah, have you seen the new guideline for postoperative pain management? It's quite detailed, and I think we need to go over it together to avoid any confusion.
Yeah, I skimmed through it, but it seemed a bit overwhelming. What's the main takeaway, Mihiraa?
Well, the guideline emphasizes a multimodal approach, combining opioids with non-opioid analgesics like acetaminophen and NSAIDs. But here's where it gets tricky. It also recommends tailoring the approach based on the patient's risk factors, like a history of substance abuse or renal impairment.
That makes sense, but how do we balance that with the hospital's existing protocols?
Good question. The guideline suggests reducing opioid use for patients with a high risk of dependency, but it also stresses that undertreatment of pain can lead to complications like delayed recovery or chronic pain. For patients with renal issues, NSAIDs are discouraged, so we'd rely more on acetaminophen and lower-dose opioids.
So, it's not just about following the guideline but also adapting it to individual patient needs?
Exactly. The tricky part is ensuring we don't overlook contraindications while still managing pain effectively. For example, a patient with a history of substance abuse might need closer monitoring, but we can't let that lead to undertreatment.
So, it's not just about following the guideline but also adapting it to individual patient needs?
Now look at question 27. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Dr. Collins, do you have a moment? I wanted to discuss the new wound care technique we're implementing for pressure ulcers. It's a bit nuanced, and I want to make sure we're aligned.
Of course, Mihiraa. What's the main concern?
Well, the technique involves using negative pressure wound therapy, NPWT, combined with antimicrobial dressings. The idea is to promote faster healing and reduce infection rates. However, the tricky part is determining which patients are suitable for this approach.
Right. I assume patients with compromised circulation or diabetes might not be ideal candidates.
Exactly. For patients with poor circulation, NPWT can sometimes cause tissue damage if not monitored closely. For diabetic patients, while the antimicrobial dressings help prevent infections, the NPWT might interfere with blood sugar regulation due to the stress response it can trigger.
That's a good point, Mihiraa. So, we'd need to balance the benefits of faster healing against the risks of complications.
Precisely. The technique is highly effective for patients with good vascular health, but for others, we might need to modify the approach or consider alternatives like hydrocolloid dressings.
Understood. Let's ensure we assess each patient's condition thoroughly before deciding on the best course of action.
Now look at question 28. You hear a nurse called Mihiraa talking to a manager. Now read the question.
Hi, Mr. Thompson. Do you have a moment? I need to discuss the new leave application process. It's a bit more complicated than I expected, and I want to make sure I understand it correctly.
Sure, Mihiraa. What's the issue?
Well, the new system requires us to submit leave requests at least 2 weeks in advance, which makes sense for planning. But here's the tricky part. It also requires a detailed handover report if the leave is longer than 3 days.
That's standard for ensuring continuity of care. What's the confusion?
The confusion arises when it comes to emergency leave. The policy states that emergency leave is exempt from the 2-week rule, but it still requires a handover report, even if it's just for a day or 2. This seems counterintuitive, especially during urgent situations.
I see your point. The intention is to maintain accountability, but I agree it can be burdensome during emergencies.
Exactly. And there's another layer. If the leave overlaps with a public holiday, the handover report must include contingency plans for potential staff shortages. It feels like the process is designed more for administrative control than practicality.
That's a valid concern, Mihiraa. I'll bring it up in the next management meeting to see if we can streamline it for emergencies.
Now look at question 29. You hear a nurse called Mihiraa talking to a patient. Now read the question.
Good morning, Mr. Harris. I wanted to go over your new medication plan with you, specifically the diuretics you've been prescribed. It's important to understand how they work and what to expect.
Sure, Mihiraa. I know they're for fluid retention, but I've heard they can have side effects.
That's correct. Diuretics help your body get rid of excess fluid, which is especially important for managing your heart failure. However, the tricky part is balancing their benefits with potential side effects like low potassium levels or dehydration.
Low potassium? That sounds serious.
It can be, which is why we'll monitor your blood levels regularly. But here's another layer. Some diuretics, like the one you're on, can also affect your blood pressure. While that's helpful for your heart condition, it might make you feel dizzy if your pressure drops too quickly.
So Mihiraa, I need to watch out for dizziness and stay hydrated.
Exactly. And avoid standing up too quickly. The purpose of this medication isn't just to reduce fluid buildup, but also to ease the workload on your heart. However, we need to be cautious about how your body responds.
Understood. I'll keep an eye on how I feel and let you know if anything seems off.
Now look at question 30. You hear a nurse called Mihiraa talking to a patient's carer. Now read the question.
Hi, Mrs. Bennett. I know this is a difficult time, but I wanted to explain how we're monitoring your husband in the ICU. It's quite detailed, and I want to make sure you understand what's happening.
Thank you, Mihiraa. I've seen all the machines, but I'm not sure what they all do.
Of course. The main monitor tracks his heart rate, blood pressure, and oxygen levels continuously. This helps us respond quickly if there are any changes. However, the tricky part is interpreting the data. For example, a drop in blood pressure could mean several things. It might be due to medication, fluid loss, or even an underlying infection.
That sounds complicated. How do you know what's causing it?
We look at the bigger picture. Alongside the monitor, we run regular blood tests and assess his overall condition. The monitor's function isn't just to alert us to problems, but to help us piece together what's happening in his body.
I see. So, it's not just about the numbers, but how they fit together.
Exactly. For instance, if his oxygen levels drop but his heart rate stays stable, it might suggest a lung issue rather than a heart problem. It's all about connecting the dots.
That makes sense, Mihiraa. Thank you for explaining.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a Dr. Mihiraa and an interviewer.
Dr. Mihiraa, welcome. Let's begin with the role of non-invasive techniques in today's healthcare landscape. How vital do you think they are?
Thank you for having me. Non-invasive techniques are no longer just an alternative, but an imperative in modern healthcare. Their significance is not only in minimizing patient discomfort, but also in optimizing clinical efficiency. Traditional procedures often come with extended recovery times, heightened risks of infection, and substantial costs. Non-invasive interventions such as focused ultrasound, wearable diagnostics, and advanced imaging are reducing these burdens. However, their importance extends beyond convenience. With aging populations and the increasing prevalence of chronic diseases, healthcare systems are under tremendous strain. Non-invasive methodologies streamline patient care, allowing for early diagnosis and timely intervention without overwhelming hospital infrastructure. In many cases, they facilitate real-time monitoring, enabling preemptive action rather than reactive treatment. The balance between efficacy, cost reduction, and improved patient outcomes solidifies their indispensable role today.
Implementation of these techniques must be intricate. Dr. Mihiraa, how do healthcare systems integrate them effectively?
Indeed, the implementation is multifaceted, requiring both infrastructural readiness and procedural adaptation. While it may seem that integrating a non-invasive approach is just about acquiring the right technology, the reality is far more nuanced. It involves reconfiguring diagnostic pathways, training medical professionals, and ensuring regulatory compliance. For instance, in robotic-assisted surgery, hospitals must transition from traditional procedural frameworks to AI-enhanced precision systems. This demands recalibrating surgical training, ensuring data security for patient biometrics, and recalibrating cost structures to justify investments. Additionally, hospitals need to develop compatibility models where non-invasive methodologies seamlessly interact with existing protocols. This is especially crucial in regions where transitioning from invasive to non-invasive methods can face resistance from both practitioners and patients due to entrenched trust in conventional procedures. Bridging this gap requires strategic deployment, rigorous validation studies, and phased adaptation across departments.
Dr. Mihiraa, are there specific considerations or challenges that must be prioritized when using non-invasive techniques?
Absolutely. While non-invasive technologies reduce physical intrusion, they introduce different complexities that demand meticulous attention. Precision is paramount. A minor calibration issue in a non-invasive imaging tool can lead to diagnostic inaccuracies, which could cascade into misdiagnosis and improper treatment plans. Furthermore, patient variability must be accounted for. What works seamlessly for one demographic may require modification for another. Another crucial factor is data integrity and ethical considerations. Wearable health monitors, for example, collect extensive biometric data. Ensuring that this data remains secure while still being accessible for clinical use is a balancing act that involves cybersecurity measures and stringent compliance with medical data regulations like HIPAA. Additionally, as these technologies evolve, there's the challenge of keeping medical professionals adept in their use without overwhelming them with constant adaptation requirements. Thus, sustained education and an adaptive regulatory framework are necessary to maximize their effectiveness while minimizing unintended consequences.
With such complexities, how do medical institutions develop action plans for implementing non-invasive technologies, Dr. Mihiraa?
Action planning for non-invasive integration is a layered process. It often begins with feasibility analysis, examining whether a particular technique aligns with existing medical protocols and infrastructure. Once viability is established, the next step is to conduct controlled pilot programs. These small-scale trials allow for real-world assessment, ensuring that a theoretical benefit translates into practical efficiency. One of the lesser discussed but vital aspects of action planning is interdepartmental synchronization. For example, when implementing AI-powered radiology screening, radiologists must coordinate with IT specialists, data scientists, and clinicians to ensure seamless workflow integration. Furthermore, insurance structures and reimbursement models must adapt, as many healthcare systems operate on legacy financial models that don't yet accommodate non-invasive advancements. Thus, the roadmap from concept to execution is not linear, but rather iterative, requiring ongoing adjustments based on emerging data and operational challenges.
How far have non-invasive techniques advanced in recent years, and where do they currently stand, Dr. Mihiraa?
The progress has been extraordinary, yet uneven across medical fields. Diagnostic imaging, for instance, has seen rapid enhancements through AI-assisted MRI and CT scans, making early detection of conditions like neurodegenerative diseases more precise. However, while wearable technology for continuous glucose monitoring has transformed diabetes management, similar progress in remote cardiovascular monitoring still faces reliability challenges. Oncology has benefited from liquid biopsies, allowing for tumor detection without surgical procedures, yet broader accessibility remains a hurdle. Furthermore, we've seen impressive strides in regenerative medicine. Non-invasive stem cell therapies are now being explored for conditions that previously required surgical intervention. However, despite these advancements, the standardization of non-invasive methodologies is still evolving. Clinical validation lags behind technological innovation, meaning that widespread adoption is sometimes slower than expected due to necessary regulatory scrutiny.
Given the current trajectory, Dr. Mihiraa, what do you anticipate for the future of non-invasive healthcare?
The future is heading toward hyper-personalization and predictive analytics. Non-invasive methodologies will move beyond diagnostics and into proactive health management. AI-driven predictive models will analyze real-time data from wearable devices, allowing for disease prevention rather than just treatment. Gene editing techniques that operate externally, without invasive intervention, are on the horizon. Furthermore, nanotechnology is advancing toward non-invasive drug delivery systems, which could revolutionize targeted therapy by delivering medication at a cellular level without systemic side effects. However, with innovation comes the challenge of ensuring equity. While some of these advancements may be revolutionary, their accessibility to lower-income populations remains a concern. Ethical considerations regarding data privacy and the integration of AI decision-making into patient care will also be critical. Ultimately, the fusion of technology, medicine, and regulatory frameworks will dictate how seamlessly these advancements translate into everyday healthcare practice.
Now look at Extract 2. Questions 37 to 42. You hear a presentation by Leo Carlos, an occupational therapist at Mihiraa Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Thank you for joining me today as I take you through the comprehensive services offered at Mihiraa Healthcare Institute, with a particular focus on our occupational therapy department, which we proudly call Mihiraa Care. Our mission is to provide holistic, patient-centered care that empowers individuals to regain independence and improve their quality of life. Today, I'll walk you through our key facilities, how we assess patient needs, our main focus areas, innovations in our practice, how we handle emergencies, and our vision for future improvements. Let's dive in. At Mihiraa Care, we pride ourselves on offering state-of-the-art facilities designed to cater to a wide range of therapeutic needs. Our occupational therapy wing is equipped with advanced assistive technology, including robotic rehabilitation devices and virtual reality systems that simulate real-world environments for patients to practice daily activities. We also have a dedicated sensory integration room for children with developmental disorders, which includes specialized lighting, sound systems, and tactile equipment to stimulate sensory processing. Additionally, our facility features a fully accessible kitchen and bathroom setup, allowing patients to practice essential life skills in a controlled environment. These facilities are complemented by our team of highly trained therapists who work collaboratively to ensure each patient receives personalized care. Assessment is the cornerstone of our approach at Mihiraa Care. We begin with a comprehensive evaluation that includes clinical observations, standardized assessments, and detailed interviews with patients and their families. One of the unique aspects of our process is the use of dynamic assessment tools, which allow us to observe how patients respond to specific tasks in real time. For example, we might assess a stroke patient's ability to perform a simulated grocery shopping task using our virtual reality setup. This helps us identify not only physical limitations, but also cognitive and emotional barriers to independence. We also consider environmental factors, such as the patient's home setup and social support system, to create a holistic care plan. The primary focus of Mihiraa care is to enable patients to achieve maximum functional independence, whether they are recovering from an injury, managing a chronic condition, or adapting to a disability. Our interventions are tailored to address physical, cognitive, and psychosocial challenges. For instance, for a patient with Parkinson's disease, we might focus on fine motor skills and balance training, while also incorporating cognitive exercises to address memory and attention deficits. Another key focus area is mental health. We integrate mindfulness-based practices and stress management techniques into our therapy sessions to help patients cope with the emotional impact of their conditions. Innovation is at the heart of Mihiraa care. One of our most groundbreaking initiatives is the use of wearable technology to monitor patients' progress outside the clinic. These devices track movement, heart rate, and even sleep patterns, providing us with real-time data to adjust therapy plans dynamically. We've also introduced telehealth services, allowing patients in remote areas to access our expertise through virtual consultations. Another innovation is our collaboration with local businesses to create community-based rehabilitation programs. For example, we partner with grocery stores to provide real-world practice opportunities for patients recovering from brain injuries. Emergencies are an inevitable part of healthcare, and at Mihiraa Care, we have robust protocols in place to ensure patient safety. Our therapists are trained to recognize signs of medical distress, such as sudden changes in blood pressure or oxygen levels, and respond immediately. We also conduct regular emergency drills to prepare for scenarios like falls or seizures during therapy sessions. In addition, we have a rapid response team on standby to assist with critical situations. For patients with complex medical conditions, we work closely with their physicians to develop contingency plans that outline specific actions to take in case of an emergency. Looking ahead, Mihiraa Care is committed to staying at the forefront of occupational therapy. One area of focus is the integration of artificial intelligence into our assessment and treatment processes. We are exploring how AI can analyze patient data to predict outcomes and recommend personalized interventions. Another priority is expanding our research on the impact of occupational therapy on mental health, particularly for patients with post-traumatic stress disorder and anxiety. We are also investing in community outreach programs to raise awareness about the benefits of early intervention for developmental disorders in children.